Back, and we'll now resume proceedings at this time. For the sake of good order, at the break, it was pointed out to me that I failed to make mention of Section 64.1 of Standing Orders, which provides that on the consideration of an appropriation bill in the Finance Committee, the clauses of the bill shall stand postponed until after consideration of the schedules. And therefore, in relation to the Appropriation Bill 2018-19, 2017 bill, the clauses 1 to 4 of the bill do stand postponed until after we conclude our deliberations on the schedules. Okay, we move on to appropriations to the Minister for Community Affairs. The first output being HCA 27, Policy Advice and Support to the Minister of Community Affairs, $1,461,419 in 2018, and $1,447,405 in 2019. Are there any questions? All those in favor of HCA 27, Policy Advice and Support to the Minister of Community Affairs, in the amount of $1,461,419 in 2018, and $1,447,405 in 2019, standing part of the schedule to the bill, please say aye.
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 And those against? No. The ayes have it. HCA 28, Administration of Community Assistance Programs, $2,759,415 in 2018, and $2,757,479 in 2019. Are there any questions? Member from Northside? Member for Newlands.
Thank you, Mr. Chairman. Just a question, if the Minister could explain why we're, or how we're going to do this. We're increasing from 2016, 2017, number of meetings, training sessions, number of social assistant assessments, medical applications, preventative services for at-risk youth. There's significant increases in all of those, but the budget increases by about $156,000 from 2016 to 2017. I just don't see how all that is going to be achievable, but maybe there's a plan to introduce greater efficiencies, but I just would hate to see that we set ourselves up for failure by not allocating the right amount.
Mr. Chairman, again, I'd just like to remind the committee that the number for 2016-2017 is representative of an 18-month forecast.
I annualized it.
Big items alone, medical applications reviewed. None of those were done in 2016-17, but we're doing 600 to 800 in both 18 and 19, and number of preventative services for at-risk youth and vulnerable families. Again, there was none in here, but in these two periods, we're doing over 700 to 900. So we just want concerned that $150,000 increase can't do all of that. Because we know the problem we've had for the last couple of years with NAU, specifically being under-resourced.
Well, perhaps I can have the acting CEO explain to you what her strategy is, which is actually on the way in terms of implementation to staff up NAU to be able to address those concerns. So maybe we can approach it from that standpoint. In other words, it's not just business as usual. So the mere fact that you have money, as we've known over and over again, is not necessarily going to deliver the services that we want. It is how the money is best utilized and how the resources are best deployed. So the acting chief officer is adopting quite a significantly different approach to managing the ministry and the unit and the department than hitherto. And perhaps it's best if I let her give you some insight into her plans and strategies.
Yeah, thank you. I mean, that's what I was driving at with my question, is what the efficiencies will be. We're not used to seeing that.
Acting CEO, before you speak, if you wouldn't mind just state your name and your position and before you respond.
Thank you, Mr. Chairman. Forgive me. I should say that I have with me Acting Chief Officer Teresa Echenike, Chief Financial Officer Joel Burke and his deputy, Ms. Melissa Worms, as well as the head of DCFS, Ms. Felicia Robinson, and the head of the NAU, Ms. Tamara Hurlston. So all of those are available to help the committee consider the budget.
Teresa Echenike, Acting Chief Officer, Ministry of Community Affairs. Through you, Mr. Chair, to address the question, there are various factors for us to take into consideration. Having assessed the services and the resources, we are in a position to restructure both organizations. We're in a position at this point to better equip, from a resource perspective, the staffing at NAU based on the vacancies that we have now in the 16-17 budget year, and also looking from the restructuring process, how we implement programs. The programs that we will be implementing will be done in a phase process. So as a result, it will not require total funding all one time. It's extremely important for us to look at establishing clear policies and procedures to ensure that our works are more effective and efficient. We will also be looking at how we utilize our resources and not only provide programs or provide financial assistance to persons, but look at the programs that can be established from a preventative approach, as well as empowering our families so that they're in a better position to help themselves rather than depending on our services. So our services will be moving forward from a very strategic approach. The staffing complement with both organizations, I feel, will equip us better moving into 2018 to start to implement some of these programs. But as I indicated, it will be in a phase process.
Through you, Mr. Chairman, I agree with that, but I think the basic problem is your account, your numbers, because in the P&E, it says 600, but in the big document budget estimate, it says 200, 250, which I think makes it more achievable. And even the clients approved for temporary assistance and financial assistance, if you add the ones in the estimate, this one, it doesn't come up to the numbers in this one. So I think we can move on.
Through you, Mr. Chair, I'm happy to revisit the numbers. I am mindful that having reviewed some of the numbers in the budgeted item, there were a few errors. And I think that it was based on some of the changes that had to be made at a very late stage. But I'm happy to review the numbers and give further feedback as necessary.
Mr. Chair.
Are there any other questions? A member for Georgetown Central.
Thank you, Mr. Chair. Through you, and I want to say thank you to the Chief Officer for making herself available. I noticed that in much of the appropriations that the information for 2016, 2017 is not available. Any particular reason for that? And the reason I highlighted is because in order for us to make a good assessment on where we're moving from to where we're going, it's hard if you have no comparison from the last budget to the next two, or the next budget for the next 2 years. We have appropriation CFS. The whole 2016 is not there. CFS 33, 34, 37, HCA 28. Many of the 2016 numbers are not there.
Can't hear what you're saying. Need you to speak into it then.
Sorry, Mr.
Yeah.
Chair. So the question is just, why is the information not available in order for us to make a better assessment from the past, from this current budget into the new one that we're going into?
Through you, Mr. Chair, again, some of the outputs that you will see for this year are new to the organization, and as a result, moving forward, we are establishing what we feel is necessary for effective and efficient services. This year and 2019 will give us the baseline that we need in terms of some of the numbers. At this point, we do not have that based on the 16-17.
Mr. Chair.
Go ahead.
Thank you, Mr. Chairman. Just to congratulate Ms. Teresa. Having worked with her in the past at ministerial level, I think it bode well for the Premier to have a person of her caliber in there. And through you, I want to say thanks to Ms. Hurlston Tamara, who I've had to interact with on different occasions and sad times, and she has been the utmost professional. And I want to thank the department for the performance of them. And all the best, Teresa.
Thank you, sir. I'm sure they appreciate that. Congrats. Are there other questions?
Yes, Mr. Chair.
Member
Through-
Freestone?
Mr. Chair.
Oh, you.
Yeah, through you, sir, to the Chief Officer.
Go ahead, member for Georgetown Central.
The committee may remember me bringing a motion in the last sitting of the House and then recalling it in respect to housing. I just want to know whether or not the amounts of applications for persons who are seeking assistance for housing is increasing, decreasing, staying at a moderate level,
That's a separate vote.
and if there's any budget allocations for the predictions, and where can I find it?
Through you, Mr. Chair, just for clarification, are we making reference to the housing assistance or housing repairs?
Member for Georgetown Central, can you clarify?
Has there been any increase in persons who are asking for assistance for housing in the new budget projections?
And I think she was seeking some clarity from you as whether housing assistance or repairs.
How for rental?
People who don't have a home.
Okay.
Temporary housing. Maybe that clarifies it.
Through you, Mr. Chair, the numbers have fluctuated. Circumstances have presented itself on numerous of occasions. We have been faced with situations where we have been approached for with persons seeking assistance for housing on numerous levels. To say that there've been a significant increase at this point, we cannot say that specifically, but we are preparing ourselves to, again, not only look at how we can assist persons financially, but truly how we can empower them in looking at options to better equip them so that they are in a position to provide housing for themselves. But at this point, it's difficult to say whether there have been a significant increase in persons seeking that type of assistance or not.
Mr. Chair, through you, just for clarity, my understanding that we cannot make projections or we don't have any projections on persons potentially will be seeking housing temporary assistance. Do we have any projections for?
Mr. Chairman, if you could just have a moment to
Sure, sir.
look at this. Sure. Mr. Chairman, the issue asked, or the question asked by the member is not covered by this particular output. It is in NGS 68, actually. But we'll still answer the question. It's in the documents if you look, but it is the current, or the forecast for the current year was 400 families getting assistance, housing assistance, essentially rental, short-term rental, over the 18-month period. And the projections for each of the years in the budget being considered now is 350 to 400 in each of those years. 350 to 450.
And that's found on page 83 of the planning estimates.
Through you, Mr. Chair. That's a significant, good enough answer for me. Just one last question: has the department made projections for potential increase in the rental market cost? Has that been factored in the budgetary appropriations?
Mr. Chairman, I don't know that we have any basis to conclude that rents are going up. I have seen none.
Are there any other questions?
Yeah, we're on the wrong one, Mr. Chairman, because I got some questions on that, but I don't want to mix them up with this one that I have other
No,
questions.
let's get
on
back
as well.
to, we're considering HCA 28. Let's finish that.
Yeah, I have a couple of questions, Mr. Chairman.
Go ahead, sir.
Okay. On this HCA 28 includes CFS 32, which includes disaster prepared activities. It used to be that, for instance, in my constituency, we had a thorough inspection. We knew who the managers of the shelters was going to be, the team. I'm not sure. I haven't heard anything about it in the last 2 years. I would hope that in your restructuring, we could get back to where we do that in May before the hurricane season starts so that people in the community are aware who the shelter managers are. And we have a particular unique situation in Northside and East End in that certain buildings in the Clifton Hunter High School are supposed to be alternate hurricane shelters, but we've never been able to access those. And I think it's time, given the population increase, that those come under some kind of proper management.
Go ahead, ma'am.
Through you, Mr. Chair, a lot of the hurricane or disaster preparedness are covered under hazard management. And so it's about us working very close with them to ensure that the various districts get the information that they need. But this specific output is intended for the elderly homes that fall directly under DCFS, and as a result, anything broader than that would be the responsibility of hazard management. But again, we're happy to work in conjunction with hazard management to ensure that the various communities get the information that is being made reference to.
I'd also like to ask, you have something on that same thing? Okay, on shelters, go ahead.
So just so I understand then, your previous answer, this vote then would be for private accommodations. When we say shelter, we mean to ensure that individuals' homes are safe. Is that what I'm understanding? Or
Senior citizen homes.
those
Right.
homes? Okay.
Yes, through you, Mr. Chair, it's the specific housing or residential cares that fall under the Department of Children and Family Services. So East End Sunrise Cottage, the Golden Age Home in Westby, the Maple House, those are the areas that we would be putting specific focus on. Anything broader than that would be the responsibility of hazard management.
Okay, I just wanted to clarify that. So I'll save my hurricane shelter questions for later on.
I have a question on the CFS 34, which is in the big book, Administration of Indigent Medical Applications. For a long time now, these have been requiring the signature of the minister responsible, and we have been advocating to get that changed because, but change the law. It's a one-line amendment. Because I just think it is better to have the professionals that we assigned all of this responsibility to doing it, because the last time we followed the chain of command up, we went through like 4 levels and no decision could be made. Not even a recommendation, it was basically just a repetition of accounting numbers.
Mr. Chairman, that's not my experience at all. I was Minister for Community Affairs for about 18 months. And the system then worked very well. I would get a set of recommendations from the chief officer, and in accordance with the law, I signed off on them or not, because the decision was ultimately that of the minister. because the minister ultimately has the answer for these things in any event, and that's the way the law was drafted. So if the system isn't working, then we need to fix the system, but I don't know that we need to change the legislation.
I disagree with him, but he's in charge. It was that way when I left. Somebody changed it after I left. But just to put it in perspective, as the system has been explained to me, somebody goes to the hospital, they don't have health insurance, they need to get indigent medical certification. They are referred to the NAU first, who does a set of numbers, can't make any decision. The officer that does those numbers refers that to the head of the NAU, who reviews those numbers, can't make a decision. They send it to the head of Children and Family Services, who reviews those numbers, can't make a decision. They send it to the chief officer, who reviews the numbers, can't make a decision. Then it goes to the minister to make a decision. If it's the minister going to make the ultimate decision, then we should shorten the process and going directly from the NAU, who's doing the assessment, straight to the minister.
Well, I don't know that. The NAU is a unit. It's not even a full department. And therefore, I would want the necessary check by the chief officer before who would then make the recommendation. But in my experience, when there are emergencies with these things, all of this gets fast-tracked. That was my experience as the minister in the time that I had there. I haven't had any of these issues since I've been minister this time around. But as I say, I'm happy to have the system looked at. If it's a problem, then let's fix it. But as I say, I don't think we need to change the legislation.
Mr. Chairman, just what I believe is for clarification. I think what everybody has said is why include family services. I know NAU does the assessment of the, I think they check to see if you can afford it or not. But why go to family services? Who family services, as I understand it, only check to say, oh yeah, we know that person in the community and they're indigent or whatever the case may be. But it may not be. It is based on numbers, on the people's financial position at the time, and there is no need to go to children and family services, which is another leg before you can get it approved.
Through you, Mr. Chair, I appreciate the concern for the timeline. As previously indicated, we try to address these matters as quickly as possible, and we appreciate the urgency of them. The reason for involving the Department of Children and Family Services is so that we have comprehensive information for the minister to be able to make an informed decision. So it is information both from NAU and DCFS that guides the minister.
So can someone explain to me then what is the information that is made available to the minister out of the family services? We know what comes out of the NAU. They assess the person's financial position. What happens in family services?
Yeah, he did ask a question.
Okay, no problem. I'm saying we know what comes out of NAU. They do the assessment, the financial assessment of the individual who's applying, which the minister needs, everybody needs to make a decision. Family services, what information comes out of there that is relevant for the minister to make a decision?
Mr. Chairman, NAU falls under the Department of Children and Family Services. So it is a line of reporting so that the matter would then go to the chief officer, following the head of the Department of Fair and Family Services, and then the minister gets a written recommendation with the background so that he or she can make a proper decision as to whether or not this is a case where government money should be spent. Because ultimately it's the minister, as I am here now, who has to account for this.
Mr. Chairman, God forbid I try to take that from him. But he just revealed two things. One, it is about money, and I thought NAU does that assessment. And number two, I didn't know that NAU was under Family Services as a subsidiary of Family Services. I didn't know that. Or they are not separate from them. That's strange. What are they trying to amalgamate them for that? Oh, but that was the recommendation to put them back together. I'm sorry, maybe I got it all wrong.
No, you haven't got it wrong, but as you quite correctly said, that was a recommendation. No, it's a unit. Yeah, yes. No, but just let me say, we are on the new management in the person of Mr. Teresa Echenike, who's now the acting. So a lot of the things that had been recommended before, and a lot of the roads down which the department and the ministry were headed, will be, shall I say, adjusted over the course of the next little while.
I'm very glad to hear that, but let's make sure it's as efficient or more efficient. But what you're telling me is that the director of Family Services was responsible for NAU all this time? No. The supervision of NAU was through the ministry or through Family Services? Because I'm confused now.
Okay, let's see if we can sort it out for you.
Through you, Mr. Chair, I can appreciate the confusion because the reporting mechanisms that were in place allowed the director for DCFS to have some involvement with NAU and some oversight. Those are adjustments that we have made because we recognize the importance of the directors focusing specifically on their particular areas and ensuring that the works that they're doing in their section that they're mandated for are separate. However, it is an ongoing process where the works of the two departments will be done in conjunction with each other. But one functions as a department, the other one functions as a unit.
So just for completeness, you have a head of NAU, but it's the head of the NAU, the needs assessment unit, not the department.
So you have a NAU head reporting to the department or what? They report directly to Family Services? They are responsible to them, to the director of Family Services.
Through you, Mr. Chair, that is what the process was before. We have now made adjustments to that because it was not working effectively. So as a result, the two heads of department now report directly to the ministry, not NAU reporting to DCFS. So we have recently made those changes.
When were those changes made, may I ask, Mr. Chairman?
Through you, Mr. Chair, since I took over role.
Well, I know what, Mr. Chair, and I don't want to prolong this because I want to get out of here and get rid of this premier the budget. But I have called everyone And this is the most confusing section of government that I've ever had to deal with through all these years. I hope something needs to get done with it. But anyway, Mr. Chairman, in particular, I'm talking about East End Sunrise Cottage, and as it relates to disaster preparedness. One of the problems we have experienced there forever is that moving those people out of there, which we have to do on a regular basis. Every hurricane that comes, we have to move them and put them amongst all the population up in the Civic Center or up by Gun Base Civic Center. And it exposes them. Their vulnerabilities goes through the roof then. Any plans in this to find elsewhere to do that? Because the others don't have to be evacuated. The one West Bay doesn't have to be evacuated, do they?
Through you, Mr. Chair, we have moved on to another output, but I'm more than happy to address the question.
Mr. Chair, 1 minute, please. And if she could excuse me. Are we on HCA 28?
Yes, that's where we are.
Can then someone tell me what the provisions of adequately prepared shelters and properly trained shelter management staff pre-disaster for the safe operation of shelters during and after disaster means?
Sir, through you, Mr. Chair, I am mindful that 8CA 38 speaks to supervision in support of older persons, so that's why I made reference to that. However, again, I'm more than happy to address the question. At this point, for safety and to ensure that our elderly persons have the type of support, supervision, and care necessary in a disaster, there are provisions in place for the Eastern Cottage residents to be moved to the Golden Age facility in West Bay. And the staffing then is adequate staffing within our facility, not necessarily in a general population of a shelter.
Any other questions? If not, all those in favor of HCA 28, Administration of Community Assistance Programs, $2,759,415 in 2018 and $2,757,479 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. The ayes have it. HCA 29, Public Education on Social Issues, $142,985 in 2018 and $142,842 in 2019. Are there any questions?
Mr. Chairman, if I could get some information on these workshops and presentations and training sessions, when and where they're being conducted, and what's the target audience for these?
Through you, Mr. Chair, it is various workshops and activities. Some are intended for the professional body and will focus on the clinical staff, and that is throughout various agencies. And there are others where we are providing the public with information, so it's public education. These activities are ongoing throughout the year, and as a result will be made known to the public as and when necessary.
I'd just like to make a little request that some effort be made to communicate these to the district MLAs in our constituencies, because information like this is important to be shared with our constituents. So I would be very interested in receiving notifications.
Through you, Mr. Chair, we will definitely keep that in mind and ensure the information is filtered on.
Go ahead,
Through you,
member
Mr.
from
Chairman,
North Side.
and these workshops and training sessions extend down to the schools for some of these social issues?
Through you, Mr. Chair, where necessary, yes, they are. We had a child justice seminar just this afternoon, and it was extended to various agencies, including the education department.
Are you getting any resistance from the education department to actually drill down to the actual students in the schools to provide some of this information?
Through you, Mr. Chair, it is a work in progress. Obviously, we will continue to build on the collaborative approach that is necessary amongst various agencies, but it is some adjustment.
Mr. Chair, through
Member
you,
for
sir,
George Dalton.
I would just like an example of one of these programs. I'm assuming that these training programs is to help persons who are at risk to better their lives. Because unfortunately, being a member of Georgetown Central, have not heard of any of them being done in my district, and I share the concern of the member for Newlands in respect to relaying that information out to the public in a good manner, so we can then pass that on to constituents who we think would benefit from it. So one concern is obviously the relaying the information for it to get out to the relevant people who can benefit from it. And secondly, can you give me an idea, one of the members from the department, of the types of training programs that they offer?
Through you, Mr. Chair, as previously indicated, it's a combination of workshops and programs on a professional level, as well as what we offer in the community. Most of the programs that are offered in the community are in conjunction with other departments, so it might not necessarily highlight only our departments or our ministry, but it might be something that we do in conjunction with other agencies. These are programs or workshops that we will indeed make available to the public as and when necessary. A lot of them are looking from a preventative perspective as well, and so we are now developing them, and they will be new as of 2018.
All those in favor of HCA 29, Public Education on Social Issues, $142,985 in 2018 and $142,842 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. HCA 31, Supervision and Support of Children, $4,333,140 in 2018 and $4,335,442 in 2019. Are there any questions? Member for East End.
Thank you, Mr. Chairman. Mr. Chairman, I wonder if we can be told how many children are adopted each year and how many applications are made.
Mr. Chairman, 11 orders were made in 2016 and 8 orders so far this year. I don't know that we have here the number of applications that were made. 11 persons were approved to be adoptive parents and are waiting on children either locally or internationally.
Member Freestad?
Thank you, Mr. Chairman. Mr. Chairman, as I look at the budget statements with the explanation as to the A&E, P&E, we are only talking about 250 to 300 and 300 to 325. Yet, the number of care services, interventions / support sessions and investigations conducted, we are looking at 16,403 to 21,700. Could somebody explain that, please?
Mr. Chairman, just for the sake of completeness, I've got that information thanks to the director. There were 54 applications over this period for adoption.
There were 54 full applications.
I don't know whether they were full.
I mean, total
Yeah.
applications.
In total, yeah.
And I was going to come to that as soon as you get it, but if I may, what demographic do we see applying for application?
A range in 2016, there were Caymanians, Jamaicans, Hondurans, Barbadians, Cuban. This year, Caymanian, Jamaican, Honduran, and Zimbabwean.
And age groups?
Oh, Lord.
No, because the last time I asked this question, it was grandmothers who was doing it, grandparents.
I don't know that that matters.
It does matter.
It is a matter for the board to determine the appropriateness and the suitability of the parents, not a matter for legislators.
No, well, it does show the direction the country is going in. If grandparents adopting their grandchildren?
Well, I don't know. I have no basis for that based on what I see here.
Well, that's what I was told the last time.
But it's a matter for the board.
Okay.
But
And we can't go into too much detail about these things because the law requires that the adoption process is confidential.
Yeah, but it doesn't say the numbers that we get.
No, but we keep drilling down. I've given you numbers. I've given you nationalities. Now we're getting into whether they're grandmothers. I'm saying it. There's a limit to where we can go with this.
you said 11 were approved out of 54.
No. 11 this year, in 2016, 8 this year. 54 total applications
Right.
over that period.
The question I'm asking is, are the others pending or have they been disposed of and not approved?
Pending.
Anyway, they have dropped, Mr. Chairman, they have dropped significantly. Last time I was told it was over 100. So, one question on that adoption. Has there been any instances of the adoption of children, or I don't know, you can say it's child, over 17 years of age?
No, 16. To 16.
No, the age of majority was 17.
Mr. Chairman, I'm advised there was one over 16, but none over 17.
Is that because the
Was-
application was made before the child was 16 and the process carried across? Okay.
Mr.
Because I think they,
Yes, Mr. Chairman,
Yeah.
the leader of the opposition is correct.
because the law, if I recall, the law it says you can't apply 16 and above.
Mr. Chairman, may I ask if the court overruled something and ruled that somebody 26 years old could be considered adopted?
No, Mr. Chairman, I don't need advice on that. That would not be the case. The court could only do that if the law permitted it to be done. So if the adoption law sets the criteria for adoptions, the court is bound by the law.
You court no though?
I'm sorry?
You're not a court though, you're not a judge?
No, but a question was posed to me, Mr. Chairman, unless the member is suggesting that I shouldn't answer the question,
No,
in which case I'm happy to accommodate him.
but you're saying that it cannot be done. You're saying that no court would do it. You guaranteeing that no court would do it.
I am saying, Mr. Chairman, that the law is the law, and the court is bound by the law as well. If the adoption law sets the maximum age for the adoption of a child, that is the law that governs adoptions. The common law would not apply, assuming the common law had any application at all, or existed with respect to this. It may be some other thing we're speaking about, but it would not be adoption as we are discussing it.
Are there any other questions?
Yes,
Member
Mr.
for
Chairman.
Bodentown West.
Through you. I noticed this vote also includes the social work intervention services. I'm just curious, how many employees do we have in that unit or doing that part of the work?
I'm sorry, Mr. Chairman, no fault to the member, but I was distracted trying to deal with this question from.
Would you repeat your
from the
question?
member
I know
from
some
instead.
numbers of people.
I noticed that this vote also includes social work intervention services. I'm just curious as to how many employees we have employed doing those kind of sessions.
Sorry. Mr. Chair, through you, the staff complement for DCFS as of 2018 will allow for 40 clinical staff members. We have also looked at the restructuring of the organization to allow for adequate staff to each of these sections. So at this point, it would be, or as of 2018, it would be 40 clinical staff members. DCFS overall, as of 2018, will have 160 staff members.
Okay, the reason why I asked that question is that I noticed on page 393 of the budget statement that deals with CFS 28, which is also included in HCA 31, that you're going from an annualized cost of 1.75 million down to roughly 1.7 million. So that's a significant drop. So I'm just curious in terms of, do you have the sufficient complement? But I noticed that your output has remained the same.
Again, through you, Mr. Chair, based on the restructuring process, we feel that the staff complement will be adequate based on the restructuring that we are doing.
Through you, Mr. Chairman, in the restructuring of the social services section, is any consideration being given to returning some of the social workers to the districts? I.e., I think before we used to have one or two in West Bay, and we had one in Bodentown for the eastern districts.
Through you, Mr. Chair, the intent for the district work is to be done by the community development officers, and the social workers will provide ongoing visits to the community as and when necessary. But they will complement each other, sir.
Yeah, well, I was going to ask a
Member
follow-up.
for Newlands.
How many community development officers do we have in Bordentown right now?
The department, through you, Mr. Chair, the department has 5 community development posts, and it is spread out throughout Grand Cayman and Cayman Brac. There's 1 in Cayman Brac and 4 in Grand Cayman.
But we don't have any specifically for Bordentown.
Through you, Mr. Chair, at present, the post for Bordentown is being utilized in another area. For 2018, we will be better equipped to ensure that that post for Bordentown is back online.
Yeah, I'd like to say thank you, because that has been, I think, for quite some time now. But in the interim, if anything can be done, because there is a significant demand for that person in the district. I don't know how you would manage that, but I really want to impress upon you that it's urgent that something be done sooner than later.
Member Freeston, I think you worked with.
Yeah, I wanted to know what's the optimum amount of development officers that is needed to effectively. Well, that's what we're on, isn't it? What are we talking about then? Social
But
workers?
we're still on HCA 31, which is supervision.
I thought Mr. Chairman, forgive me. Forgive me, but I thought she answered and said the social work was being done by the development officers. Am I correct?
Through you, Mr. Chair, in collaboration, the community development officers work along with the social workers, but they are 2 different posts.
So which one is it that we have 5 of?
Through you, Mr. Chair, community development officers that are specifically focusing on the districts are the 5 posts. The other posts that I made reference to are the social workers.
Absolutely.
Okay.
It was development officers. And I'm asking how many are the optimal to ensure what we need. That's fine if it's in the next one, Mr. Premier, but the door was open. So I'm here asking the question.
Okay, well, let's defer the question until the next segment. Okay?
But Mr. Chairman, we can't be deferring the question when the member from Newlands is asking to have the development officer in Bordentown because there's none now, and the answers we're receiving is saying that they got 5 and only 4 in Grand Cayman and they shared.
Mr. Chairman, it's like we're wasting a lot of time in this.
If
approach.
if they were answered, then they wouldn't be wasting the time, Mr. Premier.
Mr. Chairman, the point that the member is after should be dealt with
In
respect
HCA 32.
in the next one, which is right following.
Yeah.
And that was recognized by the leader of the opposition, who said, "I'll wait until I get there."
He
I would
can
suggest
wait.
that that's the approach that we should have to the issue.
And I made my rule. I said we'll hold it until HCA 32. Are there any other questions on HCA 31? If there are none, then all those in favor of HCA 31, supervision and support of children, $4,333,140 in 2018, and $4,335,442 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. The ayes have it. HCA 32, Community Development Services, $460,487 in 2018, and $460,812 in 2019. Are there any questions? Member from East End, we will take your question now.
But you already got it. Why you need to take it for again? You need me to repeat it?
Yes, I'm asking you to repeat it now, and let's get it dealt with.
How many development officers is required to have the optimal coverage for the country?
Through you, Mr. Chair, the 5 posts that we have are adequate numbers because we get the support of the social workers to also work in the various districts. So when the staff complement, support each other in their roles, it allows for adequate coverage. At this point, because of the vacancy with regards to the Bodden Town, we are short by one, but that will be filled in the near future.
Thank you.
Through you,
Mr.
Oh, sorry. Go ahead.
Mr. Chairman, which one of those station, which district is sharing with Bodden Town?
Through you, Mr. Chair, the East End, Northside, and Bodden Town are covered by one officer. Again, I reiterate, there's one appointed to East End, and their coverage for the Bodden Town that is left vacant. And again, I reiterate that the social workers also cover the district work.
Well, Mr. Chairman, if I may, could I ask who's the social worker for East End? That is covering East End.
Through you, Mr. Chair, there's no specific social worker, but the various teams, because we have a staff complement of 40 social workers, it depends on the case that those workers are working. So they will go into the districts as and when necessary.
Member for
Mr.
Bodden.
Chairman,
Newlands? Go ahead,
Mr.
sir.
Mr. Chairman, I know Mrs. Ichanike is new in the position she's in, and I'm sure she has been kept extremely busy trying to do something with it because of all the needs of that area. So I don't really. I think what I would ask of her is to look into those areas for us because it is of paramount importance that people don't play Houdini on you, especially now that you're new and you need proper information so that you can make the big decisions for the social thing. I'll go that far. I'll talk to the Premier later.
Member for Newlands?
Mr. Chairman, how many? If the Premier could give us an indication of how many community events and programs have been held throughout the district of Bodden Town. Do we have that information broken down by district?
Through you, Mr. Chair, we don't have the specific events broken down by district. However, there are various activities throughout the year where we take our activities into the districts to be able to accommodate the various persons within each of these districts. Having just completed our month of the elderly person, I'm sure that we have persons can appreciate the various activities that we've had throughout the entire island, including Cayman Brac and Little Cayman.
Member for Northside, you had a question?
Through you, Mr. Chairman, I wonder if I could have a clear definition of what is the role and function and responsibility of a community development officer.
Mr. Chairman, with your permission, sir, I'll ask the director of DCFS to address that.
Okay, that's fine, sir. Director, if you'd state your name and your position before you respond, just for the record.
Felicia Robinson, Director of the Department of Children and Family Services. Okay. Mr. Chairman, I'd like to answer the question with respect to what is the role of our community development officers, and I would like to take a position of looking at what our community development officers traditionally or currently do, and also to examine how we propose they will undertake the role of a community development officer based upon what a professional definition of a community development officer is. With your permission. Okay. At the moment, our officers operate within the communities, identifying needs, not only at a personal level, but particular community issues. That is part of their role. So they may identify the need for things such as cleanup campaigns. They may identify persons within the community who are vulnerable, who need to have some services. They may work with identifying or helping to lobby for particular interventions. So they may work closely with service clubs, other organizations, private businesses. They work sometimes to help us to address needs such as a family who may want to have some sort of donations of maybe household items. It may be trying to just get a preventive measure in place to support a family or where their children are at risk. They do a lot of that. They do a lot of work with the elderly. We do not have an elderly care unit. We're hoping to address that within the next year. So they do a lot of stuff, going out, doing home visits, identifying whether or not services are being provided for older persons, and again, trying to liaise and lobby for the resources that our older persons need. As we move forward in the next financial year, our proposal is to move to help or to build that area of our work so that we professionalize it in the way that community organization is held to be within our field. In social work, community organization is really an extremely high tier level of intervention. The worker is expected to do a lot of lobbying to address social problems, to address issues. They do needs assessments within their communities. They bring people together, they mobilize the communities in addressing their own problems. They help to identify key resources within the communities so that they can also look to build capacity within the community itself so they can work to resolve their own problems. We believe that the community development officers are key as we also move into our preventive work, where we are emphasizing doing much more protective work and early identification of problems within our families, within our communities. Our community development officers will help us to do a lot more work. They are the eyes, and in many ways they are the hands. In some instances, I think our community development officers within Grand Cayman operate a little bit differently from even our community development officer in Cayman Brat. She does a lot of work with our older persons there, and I believe she will continue to do that. But again, we have got to look at how to professionalize our work in a way that we address the needs of our community in a broader sense, but also that we leave room for professionals within our organization to grow and to move to a higher level of performance. The question was, what was the role of the community development
Yeah.
officers?
Do
And I've
you-
answered that, and I've also projected to say what that role might
Okay.
change to be.
I'm not,
Member for Northside.
can the director of DCFS confirm whether the current community officer assigned to Northside meets any of that role that you described at all?
She does some of it, sir. But we also have to recognize that our workers work based upon their level of training and skills.
You are confident that she does the majority of the things that you just explained in the community of Northside?
She does some of those tasks, sir.
And that some sounds like it's very little. Because many of the things that you described, the former community officer did. I will agree with that. But when I talk, to just give you one aspect of it, when I talk to the elderly in the community, they don't know what she looked like. They don't know the color of her skin. They don't know the sound of her voice. They haven't seen her. Can I make a suggestion that when you find a community officer that fits your professional role, would you consider using one of the rooms that exist in the district clinic for a point of contact with that officer? Because most of the people who utilize the district clinics, and I think you would find the same thing in East End as well, and maybe Bordentown to a lesser extent because of the demographics. Most of the people that she would need to are in the clinic usually at least one Tuesday and one Friday every month. And that is a good place to find out what the needs of the clinic, of those senior citizens are, and to try to cater to their needs. Because the reports that I get from my own observation, to put it mildly, I would highly recommend that you do a complete assessment of the performance of the current development officer for Northside.
Thank you for your
Other
recommendation.
questions? Go ahead. All those in favor of HCA 32, Community Development Services for $460,487 in 2018 and $460,812 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. The ayes have it. HCA 37, Housing Services, $300,419 in 2018 and $296,834 in 2019. Are there any questions?
Mr. Chair, one question.
Member for Georgetown Central.
Through you, Mr. Chair, if my understandings are correct, these are some of the homes owned by government, those being John Silver's and the Hearst Apartments. And my question is the department have any plans in respect to, particularly the one on Hearst Road, I'm not sure if I'm saying their names right, but the one right next to Jose gas station, simply on the basis of its being right on the main road and a very industrial and commercial area, has the department considered finding another location other than that one for the future?
Go ahead.
through you, Mr. Chair, it is extremely challenging for us to find alternative housing. We're utilizing the facilities that we have readily available, and wherever possible, we are exploring alternative options. But the facilities that we are presently using and the ones that are being made reference to, or the particular one that's being made reference to, is being utilized for the particular clientele because we have no alternative options for them.
Mr. Chair, one follow-up question. Is that property owned by government?
Through you, Mr. Chair, yes, it is.
Follow-up question, Mr. Chair. Is there a potential opportunity for us to sell the property as a commercial zone to potentially use those funds to acquire another location that is not so commercialized? Because the reason why I asked the question, it puts in the public domain the unfortunate circumstances that those persons who are who are living in those locations, their public life is right there to be seen every single morning, every single evening. And sometimes we've heard or had social media big blasting stories about their lives on it because everybody sees it every day. And we know that some of those individuals have difficulty that live there. So hence the want to find a different alternative for them, considering the fact that the government owns the property.
Mr. Chairman, it is not the policy of the government to extend the business of providing housing on the basis that government owns it. The policy for some years now has been to reduce the number of those units that government actually is responsible for, and where people need temporary housing, which will always be a situation that we have to deal with, that those are rented. When government takes on that responsibility, it is a significant financial and long-term obligation. So, and of course, we have to manage it as well. So that's not the road down which we are trying to move. We're trying to move away from government actually owning those kinds of units. The particular ones that the member has spoken about have been problematic for as long as I remember. At one point, they were even condemned. So I understand, and of course, I come from that area myself, so I know very well what he's referring to.
Member for Town West.
Thank you, Mr. Chairman. Through you, sir. I noticed there's roughly $250,000 budgeted for housing repairs assistance. Generally speaking, what does that normally consist of?
Mr. Chairman, there is a program, there's been a program in place for some years where there are people who do not have the means to repair their places. We find a significant number of older people in this situation. They make an application. It is considered by the department, the unit in the department that deals with this. They go out and do site visits and they see what the situation is like. And then the committee will decide, and the recommendation will come up to me as minister with the quotes and the contract that has been agreed by the government and whoever's who has won the little tender for the exercise, and then those repairs are effected. In fact, I think I signed off on 3 or 4 yesterday. We're not talking about huge sums of money now.
So, sorry, Mr.
I mean,
Premier.
I know. I'm just trying to help you understand.
Yeah.
We're not talking about huge sums of money now.
No, the reason I ask because I have a couple in my constituent that need some assistance. So I just need to understand what the scope was. So
Right.
and the process. So that's really what I was getting at. So thanks.
Member for Northside.
Through you, Mr. Chairman, I understand that one of the requirements of the policy for assistance is, particularly with elderly people, is that the elderly person who's living in the house has to be the registered owner of the property in order to get the repairs done for them. Is there any consideration being given to, in circumstances where that is the case, but it is obvious that the senior citizen is living in really decrepit conditions, whether government would consider repairing the house and registering a charge on the property so that the people who own it, right, would have to get they're going to get the benefit of it, would have to pay it off or something.
Well, that is fraught with a number of problems. One, government can only effect the repairs if the owner of the property agrees to it, and consequently, that's the case with the charge as well.
Yeah.
So,
but
so there would have to be some agreement.
Yeah, I agree. It had to be a mutual accepted thing, but I believe that the person who has managed to take over the property, shall we say, to put
We know
them up,
how it works.
right, should be amicable to that, because in some cases they're going to get capital gains beyond what government is injecting into it to repair it and also to make the house more livable. Because when the old person passes on, the houses then can then be rented, for instance, because we have to be concerned where the older person is obviously suffering. And I know one particular case, that, but the family members who have taken control of the property will not make any repairs to the house. And there is, but yeah, because my concern is for the person living in the house. I know it's not going to be easy, but
Right. I would say if people are prepared to be reasonable, lots of things can be done, and the policy is not so rigid that obviously a recommendation would come up to me as minister. So it's not as though it's written in stone and we can't adjust the circumstances. But again, if the property is not owned by the person living in it, we need agreement of those who own it before we can do anything at all.
I have one other question. Does the Department of Children and Family Services have any estimate on the number of homeless Caymanians? Because depending on who you talk to, there are all kinds of numbers being thrown around. Whether there's any, do we have any handle on homeless Caymanians?
When you say homeless, you mean people who are living without a roof over their head.
Yeah, living in
Not
a car,
that they don't own a
or
home.
be it not a hospital or be it not a public beach.
Right.
Or, yeah, okay.
NGS 68.
Mr. Chairman, we don't have a list of all the people who are homeless in Cayman. What we do have are those that the department is aware of and where government has intervened. So we have that number, but not not a comprehensive list of
No.
everybody who may be homeless.
But I think it would still be good information to get some idea of what the numbers are, and maybe we can put in place a program where people who find themselves in that situation for a number of reasons can know who to contact to see if they can get some assistance.
I'm sure Mr. Miller is aware of this, but in probably the majority of instances where there are people who are living rough, as he spoke about, there are issues that go well beyond their ability to the fact that they don't have a home. They have mental health issues. They may have addiction issues. There may be a range of other things. And I know myself of two instances where, when I was the minister in the previous administration, Minister for Community Affairs, where there were complaints, there were people registering concerns about people living rough, and the department intervened and tried very hard to get those people to live under a roof, and it succeeded for a very short period of time before they abandoned the shelter they had and went back to their previous way of living. So it is not a simple matter of simply saying, here's a nice house, go, the government will pay for it and live in it. You have to address the underlying issues. And sometimes they are, you can't really fix them. You can only manage them. So it's a complex situation, always is. And this one was yours, yeah? And this one was yours?
Are there any other questions?
Mr. Chairman, just on the housing repair assistance, what is the average wait time from when someone applies to when they get a decision for housing repair assistance?
Through you, Mr. Chair, it depends on the circumstances, and when it is necessary for planning approval or other approvals from external agencies, that extends the length of time. When it is smaller projects that can be addressed, the process is moved forward with relatively quickly. But still, it takes us several months to have the place properly assessed for us to get the background information that we need for us to obtain quotes, because we have to obtain at least 3 quotes, and then to get the project on the way. So it's a series of steps that we have to go through, and unfortunately, some take longer than others.
And Mr. Chairman, I probably shouldn't say this because this will add to the discussion, but just an experience that I think is worth sharing. Often you find with these situations, I found it in a number of them, that the homes that you're dealing with in many instances have never had planning approval, often are in breach of certainly the current regulations and requirements with respect to wiring, plumbing, setbacks, whole range of things. And so when you try to intervene on behalf of your constituent and you bring in the relevant agencies and they identify all of these things. I mean, I know one situation down in Banana Walk that I spent more than a year, and I don't think the project is still absolutely complete yet to get through all of those various things where there had been a fire. So it is a real challenge. It's one thing to say, there's the delay, but then when you work through the underlying reasons why there are these delays, we know can be too much bureaucracy, but things that involve safety like electricity, I don't disagree with them insisting that these things meet codes.
Can some priority be placed? And maybe it's already been done. I'm just not aware. But priority on disabled persons, children, elderly, because those I think are the most vulnerable, and those are probably the ones that need it, urgently. But I'm aware of a constituent of mine that is wheelchair bound, and her bathroom just cannot accommodate a wheelchair, and so she bathes outside in the yard. She's trying to get little repairs done so that she can help herself. But
And Mr. Chairman, through you to the member from Newlands, the application is in?
yes, it in. It took a while because she had to get different bits of information, but it's in now. But it's been, I've been aware of this application since about last year, February, March.
Last year.
Sorry, this year, February,
Oh,
March.
Lord.
So, and I need to follow. I keep following up with her to say, "Have you heard anything?" No. Then she'll say, "Someone called and asked for more information." So I think she needs help, sort of coordinating information, which I've been trying to do as well. But it's a sad situation.
Member for Georgetown Central.
Thank you, Mr. Chair. And through you, I have two questions. One following up off of what the Premier just said in respect to the difficulty that the department goes through in respect to assisting people because of not being up to building codes and the like. Just for information purposes, as a new representative and helping my constituents, if a home occupant is living in a place that is not, quote unquote, properly built or has planning approval, would they still be able to get it, or would government be resistant to assisting because of the safety elements? And I don't expect government to try to do electrical work on a place that hasn't had planning approval because of the safety elements. But I just want to know, so if I'm investigating those circumstances, I'll say, well, boy, the difficulty may be for this constituent to get assistance because the place is not approved. What is the protocol there?
Okay.
Mr. Chairman, what we would have done is a proper assessment of the place and to see whether it is possible with reasonable expense to get the place up to
Compliant.
code. That's what I know from personal experience we've had to do on a number of occasions. Sometimes you just can't do it, but I would think in probably the majority of instances, because in most of these cases that I've had experience with, these are not big homes, so the costs involved are not that great to address the shortcomings. So I wouldn't, to the member, Mr. Chairman, I wouldn't say that you should just write it off. I think you need to get a proper assessment first before a judgment can be made as to whether or not government can assist in those cases.
Thank you, Mr. Premier. Through you, Mr. Chair, again, that answered my question. One other question, the Premier said that they do know the number of persons who are seeking assistance for homes, and I am assuming that comes from line item NGS 68 with the number of 350 to 400. But I would hate to mislead the public in thinking that that is the number of homeless people that we have. Is there a way to differentiate the persons who are needing assistance for homes and persons who are homeless?
Mr. Chairman, I was speaking to the homeless. That's what that is persons who do not have a roof over their head. And I was saying that in many instances of the people who wander the streets and bathe in public facilities and sleep on the benches and so forth, in many of those instances, there are a range of underlying issues, mental health, addiction, a whole range of other things that need to be addressed, in addition to simply trying to find a place so they can sleep and bathe decently. And that many of these people resist attempts to put them in what they consider to be a confined space. So it is a complex set of issues you are grappling with in those instances, quite separate and apart from people who, because of a set of circumstances, don't have a home. That's a different
By
category
foreclosure.
of and government can usually assist those by providing rental assistance and those sorts of things. Yes, it might be trouble to get it, but we can do it. But they want somewhere to live. Many of the truly homeless, in the sense that I first discussed, is a whole separate set of issues you have to deal with, in addition to finding a place to put them.
Is there any consideration being given to having I think you announced an apprentice program at Public Works for carpenters and plumbers and electricians, having them doing some of this work as opposed to going out to private contractors where you have to go through the bidding and tendering process, because they would get the experience of doing it and might save some time and some money for government.
Well, I I suppose that's something we can take under consideration.
Any other questions?
Mr. Chairman,
Freestone.
I just need to find out. I know the range of stuff that given. I know the range of stuff that is given problems. We got numerous homes in the East End that made the application, and no repairs have been done on them. Just recently, one was too much, really. One a roof, and that still hasn't been done. Has any consideration been given to try to get all the different agencies together so they can appreciate the urgency in getting these things done? Because I think that's where it's fallen through the cracks. And besides, the reason those in the East End didn't get done in a timely manner is because they sent people out there to assess it that didn't even know what a house looked like, much less construction. And the other thing is, it is my understanding that there's a cap on the type of repairs that can be done, and that seems to be a hindrance as well.
Well, I'd say we can't build back a house. You know, we don't have $150,000 to spend on repairs. So it's smaller amounts of money. I'm hesitant to say what the biggest number I've seen because I can't quite remember. But the numbers are usually relatively small. You know, certainly not more than $25,000-$30,000. That's high in the grand scheme of what we try to do in terms of building repairs.
And that's interesting because I know there's a lady whose house is leaking, and it's just a matter of changing the zinc on it. And that's not good.
Right. That's the kind of project that.
And that will not
mind.
cost. That's been 2 years, 3 years now. I think it is.
Well, unless I had the specific details, I can't check. But I mean, there's always lots of applications for it, and there's always a limited budget, and there's also the limit of resources. And again, the issues that I spoke to before, making sure the place is up to code and dealing with the various agencies, which all of us know can be extremely frustrating. I mean, even as Premier, I have had challenges getting stuff done because planning fight this and this one fight this. So believe you me, I understand.
And that's why I'm asking if any efforts have been made to bring all those agencies together, planning with all the attending.
Well, I don't know that makes a great deal of difference because they all say they have their statutory duty to ensure that there's compliance. You know, so but it's not a waiver about code.
There are no further questions. All those in favor of HCA 37 HCA 37 housing services for $300,419 in 2018 and $296,834 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against? No? The ayes have it.
Mr. Chairman,
Yes, sir.
just to, the vote's been taken, but just for the edification of the committee, representatives of the various departments and agencies involved in this actually sit as part of the committee that makes these decisions about housing repairs. So they should be au fait with the issues.
Okay. Thank you, sir. HCA 38, supervision and support of older persons, $4,460,513 in 2018 and $4,477,562 in 2019. Are there any questions? Member from East End?
Thank you, Mr. Chairman. Mr. Chairman, is this Caymanians only?
Yes, Mr. Chairman.
the residents at these homes are Caymanians only.
Caymanians or people who are resident here are permanently resident here.
Other questions?
I thought it
Member
was
for
some-
Northside?
I wonder if I could have a breakdown or some indication of the daycare sessions for the elderly that is being conducted in particularly in my community.
Through you, Mr. Chair, one of the areas that we are anticipating or planning on developing for 2018 has to do with daycare services within the districts. Right now, what we have are the residential homes and the activities that take place within the residential homes, but appreciating the need for us to continuously stimulate and involve our elderlies that are in their own homes. We are planning on programs within the districts, but also looking at what is available at present that is being run privately and supporting those initiatives within the districts as well.
Member Freestone?
Mr. Chairman, it has been announced that Health City is going to do assisted living, an assisted living program up in East End. Has the government been involved with anything in that line of considering using that if that's the case? I think they're going to build multi-use buildings.
Mr. Chairman, that is certainly part of their proposal. Quite where that is in the overall development scheme now, I'm afraid I don't know. I haven't had a briefing from Mr. Thompson or anyone else about it in quite some time. So I'm not sure whether that's part of the current construction that is going on. But that's certainly part of their overall plan.
But okay. Being part of their plan, I'm just wondering if government considered whether it's them or someone else to that. I hear of at least one other company that is interested in doing assisted living in the country. And I'm wondering if government has been involved in any way, any knowledge of any of those or any plans to whether support or consider utilizing some of that assisted living.
I'm not aware of anything except the project by Narayana Health, what we know as Health City. And as we all know, government has provided significant concessions to allow that project to proceed. I don't know that I would be keen to offer government money for something like that. But we're speculating here now because I just don't have enough information.
Yeah, Mr. Chairman, would government consider doing their own assisted living project then? Like, I don't know, 56 of those assisted living homes?
I don't know, Mr. Chairman. At this stage, I don't know. I don't know what the demand would be. I don't know what the cost would be. it's not something we have considered.
Through you, Mr. Chairman, is the Children and Family Services or the elder person going to provide, because I don't think it's in the Children and Family Services law now, where the government will have regulatory authority over any private assisted living houses and care for the elderly?
I don't think there's any legislation that governs that.
My recommendation would be if there are private companies that are contemplating that, and if it is in fact a part of the agreement with Health City, that as a matter of urgency, we look at whether we put it under the old, I think it's older persons law or under the Children and Family Services law, the necessary authority for government to regulate and supervise those and make sure they meet the proper standards.
That's a fair point.
Member for Newlands.
Thank you, Mr. Chairman. Could the Premier state whether or not there are any daycare services now being provided throughout the District of Bordentown for elderly?
Not that I'm aware of, not specifically, not by government.
It's, I kind of knew the answer to that, but I wanted to make sure. But I think this is part of the issue we've had with not having a community officer, not having a focus on Bordentown. We have the Nurse Joseph Center there. Is there any intention or any possibility we could look at implementing just a daycare? No, it doesn't have to be full-time care, but I think most residents in Bordentown would like to have somewhere they could take their elderly in the morning, pick them up later on in the day, but give them something productive to do. Know that they're well cared for and so on. The Nurse Joseph Center, I think that was the original intention. It needs some work, it needs some fixing up, but I think that is something that we could easily accomplish for the elderly in Bordentown. I don't know if any thought has been given to doing that.
Mr. Chairman, under the new leadership of the ministry, a whole range of things are being looked at. It's early days yet, but of course the Nurse Joseph Center is something that is being looked at, and to see how best that can be utilized. And the point about the socialization for older people is a very, very valid one. It not only, I think, largely extends their life, but it's the quality of life as well that is so important. And they get lonely, and they miss people. I mean, I know even with my father, who has us around at 91, he doesn't see many people his own age unless there's a particular function, and they miss it. They miss it.
So,
Member for Bordentown. West.
Mr. Chairman, through you, sir, I think just as a matter of balance, because I mean we have been going through a lot of this stuff, but I just want to thank the Premier and his team, because I noticed that they have actually increased the year-on-year spend by more than 10%, a little over 10%, and they're helping more people. I know this is something that touches all constituents and, well, all members in this house, one way or other, and I know it's something you never find a balance at, but I think this is a matter of being fair. It is one of the votes that I'm happy to see that there has been an increase year on year, and we just hope that we can just have the proper policy in place so that at least the right people can get the help that they can get. So that's just my 2 cents on that.
Thank you.
Mr. Chairman,
Mr. Speaker.
just a matter of clarity for my sake. Did the member from Newland say that that Nurse Joseph Center was not in use? No, he did. That's not what he's saying, right?
I said it needs some work, but it's not being used for that purpose right now. There's other activities there, but not as a senior daycare.
But they use it for outings. Because I mean, I
Yeah, and there are
was
functions
loans
that,
myself from West Bay there.
yeah, there are functions that take place from time to time, but what I'm talking about is daycare for the seniors in Bordentown.
Thank you, Mr. Speaker. Mr. Chairman.
All those in favor of HCA 38, Supervision and support of older persons, $4,460,513 in 2018, and $4,447,562 in 2019. Standing part of the schedule to the bill. Please say aye.
Aye.
Those against? No. The ayes have it. CAY 2, Children and Youth Services or K's Foundation, $2,178,000 in 2018 and $2,178,000 in 2019. Are there any questions?
Mr. Chairman,
Yes.
through you, Mr. Chairman, I understand that a person's religious beliefs are a matter of protection under human rights, but it has long been rumored that the director of the Keys Foundation is in fact an atheist, and these views are being taught and shared to the children under their care. I wonder, perhaps if this is an opportunity to dismiss any such rumors if they are true, or if they are true, to determine that. Because it has long been questioned and raised by both my constituents and others, and I believe it is an important question that requires an answer. Thank you, sir.
Mr. Chairman, his counsel has put the Premier on the spot because I have no idea.
Mr. Chairman, it was not my intention to put anyone on the spot. It was a question that has been raised in particular in preparation or coming up to Finance Committee, sir. But it was not my intention to put anyone on the spot.
Mr. Chairman. Mr. Chairman, I know in the past it was being talked that they were going to bring this back on the Children Family Service with the management and so on and so forth, instead of putting it out the way they are. I would urge you to consider that once again. Because when you see the cars up at Francis Borden Children Home for the few children there, Mary Magdalene.
Mr. Chairman, if I may.
Member from East End.
One of the things I have written down here in red is value for money and a big question mark. Which are those 4 homes?
Sorry, Mr. Chairman, could the member ask the question again, please? We didn't get him.
There are 4 homes managed. I'm trying to find
Which
out
are the 4
what
homes?
the 4 homes?
which
Yeah,
are the
that's
4
what I thought.
homes.
Through you, Mr. Chair, there are 2 homes on each of the facilities. So there are 2 homes that's located at the Francis Borden facility, and then 2 homes that's located at the Bonaventure facility. So that's the 4 that's being made reference to.
Does that mean one is for the boys at Bonaventure and the faculty, and then vice versa at Francis Borden? How is it made up? How are these 2 homes made up? What are they for? Who do we house in them?
At the Francis Borden Children's Home, it's a combination of males and females. At the Bonaventure Boys Home, it is mainly boys that are at that facility. And it depends on their needs and the demands of that particular child, which facility they're in.
And it costs over $2 million a year to run those 4 homes. That's $500,000 per home.
Through you, Mr. Chair, to ensure that the facility is functioning at the level that it should be functioning at, a certain amount of staff members have to be maintained, whether we're at full capacity or not. So we have to take those factors into consideration when we take costs into consideration. At present, the homes are not at their maximum capacity. However, we are at approximately 48 staff members for the homes, bearing in mind that the homes are operated on 24/7 operation. Based on the concern of value for service, one of the aspects that we will be looking at is a comprehensive assessment or evaluation of these programs to ensure that we are indeed getting value for service.
Mr. Chairman, what is the success rate of these homes? Meaning, what percentage of the kids that go to these homes we can be comfortable that our intervention turn them into productive citizens?
Mr. Chair, through you, at present, unfortunately, I do not have those numbers in terms of success rate. However, the Department of Children and Family Services and the various agencies involved endeavor to ensure that the services that we are offering to our children are at a high standard to allow them to be functioning citizens within our community.
Well, Mr. Chairman, if that's the case, then we need to resolve that question Mr. Harris had,
Sir.
because that certainly does not bode well that a member here is saying that there are rumors that the person in charge is an atheist of one of these homes. And certainly that does not, if, God forbid, but if that is the case, then that certainly does not bode well with turning them into productive citizens. That is my view, and I can have that as much as I want. Mr. Chairman, it can answer that, but my question is: does the court commit juveniles to these places?
Yes.
Still, I mean, or is it just used by the social services, family services?
She can answer first.
Through you, Mr. Chair, children are placed in these facilities on care orders, so that is done through the court system.
And have we ever had to, how many or do we send them elsewhere because we cannot deal with them there? We find out after a while or something. Like how we have some overseas and overseas care.
Through you, Mr. Chair, when we consider overseas options, it's for therapeutic reasons whenever there are mental health issues that cannot be addressed immediately here within our homes. Those cases are usually more extreme and more difficult for us to handle here within our facilities, and that's when we look at our overseas option.
Member from Bontown West.
Thank you, Mr. Chairman. First, I have to support my colleague from Prospect. I too have heard concerns concerning the management of that area. But just to expand on the member from East End, what he raised, I mean, I'm looking at the 2016, 17, 18-month forecast, and even annualized, based on these numbers, it says that we have basically 32 children in these homes at roughly 2.4, at more than 2.4 million. That's more than $75,000 per child. And I mean, we must submit from a value for money standpoint. if the very families, I mean, you're talking more than $6,000 a month, wouldn't we, for that kind of money, I mean, at some point, wouldn't we best try to work with the family in terms of trying to assist them or something? But I mean, clearly, this amount of money per child, I mean, it is quite expensive. I mean, I do understand the role that the home play, but at the end of the day, I mean, we need to look at value for money and also again at the success rate. But there definitely, this is one of the things that I think we need to understand what is happening to those children there, what is happening to them after they come out. I know in yesteryears gone by, the Bonaventure homes used to literally put out some really good people. And we're just not seeing that again. So I think it's a fair statement to find out what's happening there from a management standpoint.
Mr. Chairman,
Chairman?
and just to clarify the position, I stated director earlier on, but I understand the position held is in fact general manager. And again, it is only to clarify if the rumors are true or to dismiss them once and for all.
Thank you. Mr. Chairman, just to ask the Honorable Premier, how confident are we that we are effectively, especially just using the girls' home for as an example, that we are effectively providing what it is we're supposed to provide for these girls in terms of the varying needs. You may have children who are there because of social issues in their family, whatever, who are not delinquents. They haven't done anything wrong. They just need a loving, nourishing environment. And then you have kids there who have gone down the wrong path. You're mixing the two together. So you're locking the doors. The place is secure. But then those kids who may just need counseling and love and affection are treated the same way. So how effective are we at delivering care when we don't separate them out?
Mr. Chair, through you, as much as possible, we try to keep our children within their homes and within their family settings. We also explore foster care options prior to consideration for children going into Keys Foundation or any other option. Keys sometimes becomes our last option, and it is at times necessary as it relates to value for services. Again, I reiterate that one of the areas that we will be looking at for the new budget year is having the programs evaluated to ensure that they are meeting their mandates. The social workers are all assigned to the children within these facilities, and case plans for the children are reviewed on a regular basis, usually every 6 months.
Mr. Chairman,
Yes, sir.
years gone by, there was a facility built on the site of Bonaventure for the girls. How is that being used now? Is this an extension for the male population there?
Through you, Mr. Chair, at present, the Bonaventure facilities only facilitate male residents. The facility at the Francis Borden home is a combine of male and females, and again, depending on needs, determine which of the homes they're in.
So both buildings at Bonaventure is used for the male? It was one that was built there by Rotary, and then when I was there, we built one for the girls.
When necessary, the Phoenix House, which is considered to be a more secure facility, is utilized.
Last question, Maple House, where does that fall under?
Maple House is directly under the Department of Children and Family Service, and one of the facilities that we monitor directly.
Yeah. Is that the one now that has been transferred to Northward?
Through you, Mr. Chair, the facility is still in operation. The property in Northward is still being renovated, and the Northward property will be utilized for our younger children, and the Maple House facility will be continued to be used for our older residents. Both of the facilities are for persons with special needs.
Okay, thank you.
Member for Bordentown.
Thank you,
West.
Mr. Chairman. Roughly of the 2.2 million that's going to this area, roughly how much is going to Francis Borden and how much is going to Bonaventure Home? Ballparkish, not the exact number.
That is not information that I have readily available, sir.
Mr. Chairman, part of the difficulty, which I should have anticipated in answering these questions in more detail, is that these are run by the Keys Foundation. They are not run by the Department of Children and Family Services. The Keys Foundation has a board and a management team. So we probably should have brought the chairman of Keys here.
I accept that, Mr. Premier. I'm just trying to figure out, because one of the things when, you look at a 24-hour care, and you're talking about 10 kids in terms of Bonaventure Home. If I'm doing a rough number, I'm actually realizing if it takes the same amount of care, you're talking now in excess of being around the clock of over $100,000 per, since there's certain fixed costs and we're not at capacity, which I'm glad we're not at capacity because no one wants this problem to be in any country. But at the same time, it's a possibility that Bonaventure can be running at more than 100,000 per child. And if that is the case, then I think we definitely need to take a look at the number and also look at the output for that much per child. Granted that we're not even spending that much on even scholarships or even prisoners or anything. So that's really where I was trying to get with the question. But we will see if we can take it offline and get to the answer. Thank you.
All those in favor of
Chairman?
CAY2?
Mr. Chairman.
Yes, sir.
Thank you. Mr. Chairman, I just merely want to say that there are so many calls on these services which government provides through this department. The department are called to provide. And I know that the department staff go through plenty. I'm, as an elected official, I get all sorts of things, said all kinds of complaints, but they go through plenty in trying to deal with the many requests that they have. And so I want to put on record my thanks also to them for many times going far beyond the call of duty in seeing that these people are assisted, sometimes which MLAs criticize, and we criticize the amount of money spent and who's getting and who not getting, and we hear all sorts of accusations. But I certainly believe that the department go through plenty, and we need to put on record our thanks to them.
Thank you, sir. All those in favor of CAY2, Children and Youth Services, Case Foundation, $2,178,000 in 2018 and $2,178,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. NGS 63, School Lunch and Uniform Programs, $124,000 in 2018 and $124,000 in 2019. Are there any questions?
Mr. Chair,
Go ahead, sir.
2 questions in this respect. First one being the number of children receiving school uniforms will be increased by 100% from 2018 to 2019, moving from 75 to 100 to 150 to 200 in the respective years. Is there a prediction that there may be a lot more persons who need school uniforms? Is there indicators that the department is using to get that estimate? I know it's just an estimate, but when you jump from a whole extra 100%? Is there some sort of indication for that?
Through you, Mr. Chair, based on the information received, it is apparently a typo. The numbers should be the same for 18 and 19. And the funding is the same.
Yeah. Thank you, Mr. Chair. I just wanted to clarify that. The second question, Mr. Chair, was I understand the process that we were discussing before in respect to persons who are elderly, who need assistance for housing. They go to the needs assessment unit to be assessed. They then let the department know. The department then funds it. So it doesn't come out of the needs assessment unit funding allocations. But in respect to lunches, the process is opposite. A person will be assessed. The department will decide whether or not they need it, but they will have the funding comes out of their budget. Considering the fact that the education department deals with the individuals who provide lunches at the schools, wouldn't it make sense for the education department to deal with the handling of paying for the school lunches? Because I'm assuming the process now, unfortunately, I haven't dealt with it before, is that they have to get a voucher of some sort or let the school know that it's paid for through the NAU. Maybe it would be less pressure on the needs assessment unit. Any particular reason why the process is different, even though they're not the ones administrating it?
Through you, Mr. Chair, the process is done through NAU, and at this point, there is no indication that this is a matter that the education department can properly manage and facilitate. It is something that we're happy to explore and look at in more detail, but at this point, because the assessment process is done through NAU, it is easier for us to just follow through with the process of ensuring that we communicate with whether it's the PTA or whoever run the facility at the school to ensure that the children are getting the school lunches. But we're more than happy to look into the process if it can be more effective.
Mr. Chair, I didn't ask the question to be antagonistic. It's just my comprehending of you do one process with one matter in respect to the housing assistance for elderly, and they make the assessment, they approve it, somebody else, another department pays for it. In this particular position, they do the assessment, approve it, and handle the money. I thought it would be one common process for each scenario, but there's obviously two different kinds. I was just trying to understand the practicality of it and if it would have made more sense. But thank you for the answer.
Are there other questions?
Yeah, just one to you, Mr. Chairman.
Go ahead, sir.
There are a number of private sector groups, Feed Our Future, Kiwanis, and others who contribute. Is this representing the numbers that they are able to do it for? Because I know their criteria is the numbers that they're unable to handle. In other words, this represents what is their shortfall in funds.
Through you, Mr. Chair, this particular service complements what is being offered in the community.
All those in favor of NGS 63 school lunch and uniform programs, $124,000 in 2018 and $124,000 in 2019, standing part of the schedule to the bill, please say aye.
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 Those against? No. The ayes have it. NGS 64, care of the indigent and disabled elderly persons, $1,650,000 in 2018 and $1,650,000 in 2019. Are there any questions? There are no questions. I put it. Member from East End?
Thank you, Mr. Chairman. If you prefer that we say something, then that's fine. I can.
No, I didn't even notice you go for your
Okay.
your thing.
Mr. Chairman, is this how much we spend at the Pines?
Mr. Chairman, I don't believe the Pines, this covers the Pines. Just let me check. Yes, Mr. Chairman, I'm wrong. This is our government's contribution to running of the Pines. This is not the cost of the Pines. This is what government contributes.
But do we also have residents in there that we pay for?
Yes.
And where is that represented here? Under the one with the other homes, the West Bay and the East End?
The number of residents is indicated in the quantity, which is 20 to 25. However, at present, Pines overall are at 36 residents. So we contribute to part of the funding for the Pine, but not the total expense of the Pine.
No, I understood that. This is a contribution to the Pines. I am asking, how many residents do we have there that we pay for separately?
Through you, Mr. Chair, at present, we cover 27 persons within the Pines. And that is through this costing.
That's from this cost then? Pardon me?
Mr. Chairman, I need to clarify something because my recollection is different than.
Member for Bond, can we just hold that until he consults, please?
Mr. Chairman, I've clarified it now. The entire cost is now wrapped into that number.
I think just the,
That is the cost of the individual 27 persons. Is it wrapped into that
Plus a
number?
contribution.
Whatever we give to the Pines, this is it here. It's all in there.
But if we have 27 there now, we only had 24 in 2016-17 budget, right?
That was a projection.
sorry, Mr. Premier, if you
forecast.
don't.
That's
Mr. Chair,
1 minute, 1 minute. That's forecast to the end of December.
Right.
But did someone not say it's 27?
Yes, it's a forecast. So at the time, there are currently 27 there. These are projections. So until we get to the end of the year, we don't know exactly how many people would have utilized the service. We know we project so many, we forecast so many.
And I understand that, Mr.
Right.
Premier, but
That's all this
but
is saying.
since this document has been made, 3 more has gone in. That's what you're telling me.
It would appear so.
Can I just, Mr. Chairman, can I just say something I think which may probably help? What actually makes sense to me as a new member going through this is looking at the bottom and then seeing the breakout of the different expenses. So if you go to page 490 of the purchase agreement, you will see that even if you use the 27 as the 18-month forecast, that will work out to roughly 30,000 per person. And then if you look at the budget for 2018 and 2019, a range of 11 to 15, which is roughly around 12, it still works out to roughly the same in terms of per patient costs. So that's one of the things I look at. So the numbers actually are consistent on a per person from year to year. So in terms of the numbers of the actual spent, but we have to kind of break down because some of these numbers are wrapped up into several different votes. So you have to go to the breakout and then get a better understanding of it. But the numbers are consistent on a per person basis from year to year.
Okay. There are no further questions. Then all those in favor of NGS 64, care of the indigent and disabled elderly persons, $1,650,000 in 2018 and $1,650,000 in 2018, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. NGS 65, General Programs and Children's Services, $118,000 in 2018 and $118,000 in 2019. Are there any questions? All those in favor of NGS 65, General Programs and Children's Services, $118,000 in 2018 and $118,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. The ayes have it. NGS 66, Foster Care for Children, $225,000 in 2018 and $225,000 in 2019. Are there any questions?
Mr. Chair?
Member for Georgetown Central.
Is 4 to 9 number is the amount of kids receiving foster care? Is that all there is receiving foster care in the Cayman Islands? Or I misunderstand that because it says number of children fostered.
Mr. Chair, through you, this is only specific to the, sorry, Mr. Chair, through you, these numbers are only specific to the NCVO foster care home.
Okay.
Understood.
Because there's no projections of increase either in the numbers or the funds here.
Well, Mr. Chairman, there actually is because the 2016-17 budget was a 18-month budget.
No, but if you annualize that 337, it comes right back to 225.
Yeah, but the numbers of children are the same
Yeah. So I'm saying that we don't
annually. So they're actually projecting a higher number of children in each year. Yeah, but they're projected 4 to 9 on an annualized basis, and this is the same for the 18
Well,
months.
that's the question I was getting to, because then I think your funds need to increase because you're doing more children.
Well, we don't know. I mean, it's 4 to 9. It could be half. It could be twice as much.
I just think you're gonna need, you know.
All those in favor of NGS?
1 minute, please.
Sorry, Member for East End.
No, this is only in the, but at NCVO.
It's only at NCVO.
This is not the private children farm that they operate.
There are some issues surrounding foster parenting in this country that we need to deal with. Do we make provisions for them in the support for children?
Through you, Mr. Chair, that is correct. The supervision and support for children, HCA 31, covers the foster care services. This particular output only looks specifically at the NCVO foster care program.
Okay.
All those in favor of NGS 66, foster care for children, $225,000 in 2018, $225,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. The ayes have it. NGS 67, community programs, $151,000 in 2018, $151,000 in 2019. Are there any questions? Member for East End.
Mr. Chairman, can I ask what is done for the outlying districts in this Meals on Wheels and after school activity?
Through you, Mr. Chair, Meals on Wheels have proven to be a very valuable contributor to our community. They are looking at expanding to the outer districts. However, we take into consideration that a lot of their services are based on volunteers coming in as well. So it's about working with Meals on Wheels and seeing how we can best support them for the necessary expansions to take place. They have grown significantly, and I think that as we continue to work with them and support their endeavors, that we will be able to expand into the districts. At this point, that is not possible, but that is something that we will definitely look at.
Pardon me? Okay, so Meals on Wheels are only in Georgetown then, right?
Sorry,
1
Mr.
minute.
Your question there? No. Okay. And there was a question there, Mr.
Yes.
I think, can you ask if you could restate it for her?
I've said Meals and Wheels are only in Georgetown.
Through you, Mr. Chair, no, the Meals on Wheels at this point is extended into Northside and West Bay as well.
Okay.
If I'm not mistaken, into the Bontown area. It is probably only the Eastern District, the East End District, that there might be some lapse with at this point.
So who operates the one East End?
Well, you got one outside.
So Ali, you tell me none only. That's what I'm asking. I don't know.
To you, Mr. Chairman.
I don't know because
Member for
we have been doing quote unquote Meals on Wheels out east 10 years? 10, 12 years? Somewhere in that region out of the Civic Center. That's why I have been so adamant that we change the kitchen. Is that's not as, it's just the name we got there, then it's not associated with Georgetown.
Mr. Chair, through you, not that I'm aware of, but this is a
Okay.
good indication of why it's so important that we get an overview of all of the services that are being offered throughout the community, because some of the services are being offered through associations, through churches, through private sector, and so we need to establish a running list so that there's not an overlap or duplication in services, and also so that we can complement each other.
Okay, all right.
Mr. Chairman,
Okay, no problem.
Mr. Chair,
Yes, sir.
I think we may have unintentionally misled the committee a little there. I've just been handed a note which says that Georgetown is serviced by the Meals on Wheels program, Monday to Friday, North Side and East End, 3 days per week. West Bay is currently underserved as only 20 of the over 100 persons needing it are receiving meals.
so, hold on.
Mr.
Sorry.
Chairman, I have contributed a lot of stuff to it, but I didn't know what it was, really.
Sorry, Mr. Chairman.
Member for Bodytown West.
Yeah, I just want to set the record straight. One, there is a Meals on Wheels program that is operated in Bodentown East and Bodentown West. I know because I actually volunteer to deliver those meals, and this is one time I would ask the government to consider, if possible. I know in Finance Committee we can't increase the amount, but for the work that they actually do, and for the people that actually get it, because Bodentown is roughly between 40 to 50 meals in Bodentown East and Bodentown West 5 days a week. And I know we have some hotels that have come on board, like the Westin and the Ritz, who I think one day out of the month they actually provide meals. But this is one program I can tell you that works, and I would seriously consider, ask the government to really look at put more money behind this program. Hope Foster in Bodentown does a lot of work with this. Out of our own home in terms of preparing meals and everything else. So I would ask the government or the committee if they could look at a way you can put more money behind this, but this is a really good program.
Yes, Mr. Chairman, we know government has been a major contributor to this program for many years, certainly more than 10. But the government is not the only financial supporter of this. It's supported by the Rotary Club. It's supported by a range of other entities. So this is not the only money with respect to this.
Through you, Mr. Chairman, I'd like to make a request of the new chief officer, is that you look carefully at what's happening in Northside, because the reports that I get are not good. I'll talk to you privately about what is reported to me.
Through you, Mr. Chair, I appreciate the feedback that we will receive so that we can ensure that the services are being utilized to its full capacity, but to the benefit of persons. Also, because of the value of the Meals on Wheels program, I stand corrected, and I do apologize to them because I did not have the information readily available to me, but I appreciate the value that they offer throughout our island.
Okay. All those in favor of NGS 67, community... Oh, sorry.
Apologize, Mr. Chair. I just want to take this opportunity to publicly thank the organizer for the Meals on Wheels. that being in particular Miss Beulah Markfield. She's been tremendous, particularly in the Georgetown area, and I could hear other colleagues saying in their districts as well. And I just want to have it put down on record that she's been doing a tremendous job for the last many years, and I'm proud that the government is continuing to support her program and her vision for helping those who need food.
And Mr. Chairman,
Yes, sir.
what was said earlier that West Bay is underserved is because they've been trying to get facilities, and there is, of course, more requests to be served, for people to be served in West Bay. And they've been trying to get a place, and I think they are working on that with government for one of the government buildings. But I certainly want to thank them because, as the Premier has said, there's a lot of community effort with it. Mr. Imperato family is one of the big ones. Rotary, other people helps, but they're the big pushers of the program, and it is really something that is valuable to the community.
Okay. Thank you, sir.
Mr. Chair.
Go ahead, sir.
Thank you, Mr. Chair. I, too, want to endorse Ms. Hope Foster in the Bordentown area, the Meals on Wheels programs. I actually support what they're doing there. Very involved in it. And I endorse all that the member from Bordentown West has said. And I do know that there's additional persons who want to be serviced by this route and are unable to take benefit of this of these daily meals throughout Monday through Friday. And there's also now just received a request this week if we could consider trying to continue this on Saturdays and Sundays. So we've been looking at trying to find a way to fund that, but definitely since 2009 when I was first elected and took up reins of the community services department at the end of my reign, I was desperately trying to get more funds routed to the Bordentown area Meals on Wheels program. I was always told that everything has to go through the Georgetown centralized location, and then they would consider whether Bordentown would get anything from that. So I just want to say that Bordentown is the fastest growing district, and Bordentown West and Bordentown East are the two largest of the 19 pieces that have been cut up in, parishes. And I know what it is. Maybe I don't agree with it, but thank you for allowing me to say this. But I do endorse what the Bordentown West member said.
Thank you, sir. All those in favor of NGS 67 community programs, $151,000 in 2018, $151,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. NGS 68, rental accommodation for persons in need, $1,950,000 in 2018 and $1,950,000 in 2019. Are there any questions? All those in favor of NGS 68, rental accommodation for persons in need, $1,950,000 in 2018 and $1,950,000 in 2019.
Mr. Chair.
Standing part of the schedule to the bill, please say aye.
Aye.
I was reading.
It's okay, Mr. Chair. I just wanted to make a comment. As the only minister east of Prospect, I just wanted to say that this was in no way with Savannah and Newlands. I don't really know the need for that area, but I'm sure there's requests that comes in. I haven't heard about those areas being serviced, but I still share the concern.
Let me repeat then. All those in favor of NGS 68?
Mr. Chair,
Yes, sir. Did I overlook you? My
well,
apologies
Mr.
if
Chairman,
I did, sir.
we
I
want
recognize you.
the Meals on Wheels, right?
No, we finished that. I put it to the vote, sir. I know it's getting late, member from East End, but
You know I don't sleep in here, unlike you.
I'm about to take the vote for NGS 68. We had got to the point where I asked for an aye and I heard all the ayes. I did not ask for the noes. So I'm going to put the question again for NGS 68. All those in favor of NGS 68, rental accommodation for persons in need, $1,950,000 in 2018 and $1,950,000 in 2019. Standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. The ayes have it. NGS 70, burial assistance for indigents, $150,000 in 2018 and $150,000 in 2019. Are there any questions?
One question, Mr. Chair.
Member for Georgetown Central.
This question is not in relation to the amount, but rather to a concept that could potentially be discussed here by the chief officer. Obviously, we do not have unlimited amount of property for funerals services. Is it I guess maybe this is not the burial services. Maybe this is not the line item to discuss this, but is it something the department would consider? Wrong department. I apologize, don't worry.
No question. Okay. There are no questions. I put the question. All those in favor of NGS 70, burial assistance for indigents, $150,000 in 2018 and $150,000 in 2019. Standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. NGS 71, support for battered women and children, $325,000 in 2018 and $325,000 in 2019. Are there any questions?
Yes.
Member for Northside.
Through you, Mr. Chairman. This talks about public education programs on domestic abuse and sexual violence. Is there any extra provision in here because of the new international sensitivity to sexual harassment by people in powerful places? Because I've had some...
No, Mr. Chairman.
But I think we might need to look at it because I don't believe that we are insulated entirely from it. And I believe that because I have had complaints from some employees and they don't know where to turn. And they find themselves in some very touchy situations. And I have recommended that they go to the crisis center and stuff like that. But I think that part of the public education has to be to encourage people to come forward and deal with these issues.
Through you, Mr. Chair, I take the point, and we will be looking into this matter.
That's all. Thank you.
There are no further questions. All those in favor of NGS 71, support for battered women and children, $325,000 in 2018 and $325,000 in 2019. Standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. NGS 72, Therapeutic Services for Young Persons, $25,000 in 2018 and $25,000 in 2019. Are there any questions? Member for Northside.
Again, Mr. Chairman, and there's no increase in the funding here, but just for my own edification, how do you get referred to these children in need of these therapeutic services? Is it through education or the medical fraternity?
Through you, Mr. Chair, these particular numbers are based on the referrals that we obtain from the psychologist, and the treatment is outsourced.
There are no further questions. All those in favor of NGS 72, Therapeutic Services for Young Persons, $25,000 in 2018 and $25,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. TP 41, Poor Relief Payments, $7,394,400 in 2018 and $8,532 in 2019. Are there any questions? All those in favor of TP 41, Poor Relief Payments, $7,394,400 in 2018 and $8,532,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. TP 42, Poor Relief Vouchers, $1,550,000 in 2018, $1,550,000 in 2019. Are there any questions?
Sorry, Mr. Chairman, sorry,
TP 43.
42 or 43?
My apologies. It should read TP 43.
Thank you.
Thank you. Are there any questions?
Yeah. Through you, Mr. Chairman, what's the difference between a poor relief payment and a poor relief voucher?
Mr. Chairman, the poor relief payments are the permanent financial assistance and the temporary financial assistance. The poor relief vouchers are like food vouchers and that sort of stuff.
And a poor person can get both, depending on the circumstances.
Depending on circumstances.
I have some other questions, but I'll bring it up under the next two. Or you can leave them there if you want.
If they're appropriate under this heading, let's deal with it. Okay. All those in favor of TP 43, Poor Relief Vouchers, $1,550,000 in 2018 and $1,550,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. TP 47, Ex Gratia Benefit Payments to Seamen, $7,098,000 in 2018 and $8,190,000 in 2019. Are there any questions?
Yes, Mr. Chairman.
Go ahead, Mr. Member for Northside.
Yeah, I know how this started, and it started separately, but hasn't the time come now to where we amalgamate 41, 47, 48, or is this separate so that some people are getting 3 poor relief payments? Because isn't the mean test almost the same?
No, Mr. Chairman, I do not believe there is any basis for saying that some people are getting all 3. And if there are instances of that, I hope that the member will point them out to us so that we can address them. but the distinction is the ex gratia payment to seamen and servicemen is based on the principle of their contribution. They will not wish to see them amalgamated so that their payments are under poor relief. I'm not asking that because we've had meetings with the seamen in particular. So they need to be kept quite distinct. The criteria to qualify for them, I believe, is similar, if not exactly the same, in terms of what their income actually is.
Mr. Chairman.
Member for Savannah?
Are we now to ex-servicemen?
No, not quite. So we're doing with payments to ex gratia benefit payments to seamen.
Okay.
TP 47.
And I guess the other question would be, is it possible for a seaman to be getting the ex gratia benefit payment and the wife to be getting the poor relief in the same family?
Yes.
My point is that what we need to be giving to people is $1,000 on the living amalgamate and give everybody the same thing.
As long, Mr. Chairman, as long as the combined income of the house does not exceed the ceiling.
So the other question is then, in the case of an ordinary family who's not a seaman, can both the husband and wife get poor relief?
Yes,
As long as the income doesn't go above.
correct.
Just not taking care of them. This is barely make them live. Trust they need a lot more now.
Believe you
Any
me,
other questions?
Mr. Chairman, believe you me, $550 a month or $650 as we putting to don't go a long ways.
That's what I'm saying.
All those in favor of TP 47, ex gratia benefit payments to seamen, $7,098,000 in 2018 and $8,190,000 in 2019, standing part of the schedule to the bill. Please say aye. Aye. And those against, no. The ayes have it. TP 48, benefit payments to ex-servicemen, $982,800 in 2018 and $1,134,000 in 2019. Are there any questions? Member for Savannah.
I had a question, but as I kept looking, I probably figured it out. As you know, the serviceman is a dying breed.
Yes.
But the increase, I assume, for 2019 would be the additional $100 a month.
Correct, Mr. Chairman.
Okay.
From $550 this year to $650 starting in January 2018 to $750 starting in January 2019.
Through you, Mr. Chairman, has the discrepancy been resolved between what the Association of Ex-Servicemen are claiming that are veterans as opposed to the number that we're paying the benefit to?
Mr. Chairman, the member is right to point that out. We are still in discussions with them about this mysterious issue.
The other thing, I just want to make sure that we're not making payments to ex-servicemen for Korea War, Vietnam War, Iraq War, and places because they should be being taken care by the U.S. government themselves, and we shouldn't have to do it. But that's their problem. They go claim it because they're entitled to it.
Agreed. I think, in fact, I'm fairly certain some of that was happening. We're trying to resolve those.
They're getting both.
Are there other questions? All those in favor of TP 48, benefit payments to ex-servicemen, $982,800 in 2018 and $1,134,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. TP 50, preschool assistance, $100,000 in 2018, $100,000 in 2019. Are there any questions?
Mr. Chair.
Member Force.
Thank you, Mr. Chair. Through you, can the chief officer identify if there's any criteria, that educational criteria, that these preschools that are given the cost payment for once approved by the NAU, is there any educational criteria for them? Because what I find in some of the preschools that I look around for my constituents, are there just their care centers and they don't give them any, they just supervise them until the parent gets home. And I bring it up because the relationship to what I find in some of the primary schools where teachers are saying children are coming to the schools not having the basic spelling and counting abilities. So there needs to be some criteria put on these preschools if the government is going to spend money on them, to at least give them the basics, cat, fat, 100, come to 100, whatever it may be, rather than just a babysitting service. A preschool is supposed to be exactly what it says, preschool. So the question is there any criteria that these preschools that receive funding from government or government pays for, is there any criteria educationally on them? Please go ahead.
Through you, Mr. Chair, the Education Department has an established early childhood unit that monitors preschools, and it is my understanding that they have specific inspections and criteria that all of the preschools must follow.
So there are educational criteria? Yes, thank you.
Any other questions? All those in favor of TP 50, preschool assistance, $100,000 in 2018 and $100,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. TP 57, children and family services support, $485,000 in 2018 and $485,000 in 2019. Are there any questions?
Yeah, true, Mr. Can we have an explanation of what that covers?
Through you, Mr. Chair, when we have children that come into our care and becomes the responsibility of DCFS based on a court order, there are times when those children have specific needs that need to be addressed, and it might be medical needs that require them to travel quite frequently. These are some of the services that would fall under that category.
Thank you.
Member Freestand.
Thank you. Mr. Chairman, is it fair to say that we have 70 to 80 kids in our care now?
Mr. Chair, through you, we have various children that are on present, on court orders, and they vary whether they're in our facility or in private facilities. The numbers could range quite high. At present, I am told that we have 48 children that is under care orders.
Member Freestone?
Thank you, Mr. Chairman. Mr. Chairman, I wonder if they could say how long was the average length of time that we have to care for them?
Through you, Mr. Chair, circumstances will determine length of time. Obviously, it is necessary for us to continuously review care plans for the children that are on these orders, and as much as possible or as quickly as possible, try to get them back into their homes or have them with family members. It varies depending on the circumstances of the particular child.
But we do get them reintegrated into their families in all instances.
Through you, Mr. Chair, that is the goal, to have them with families or have them reintegrated back into their family settings. That unfortunately is not always the case, but as much as possible, that is what we strive for.
So, Mr. Chairman, I wonder what happens to those who don't get back into their families or with family members. What do we do with those?
Through you, Mr. Chair, the Department of Children and Family Services also have an aftercare program that is extended to children that reach the age of adult. And so we continue to monitor them and give them the necessary support to move into independent living in the community.
And do we pay for that?
Those numbers are relatively small, and we do support them as much as we possibly can, yes.
Can we explain as much as we possibly can, please?
Through you, Mr. Chair, it might be that we are providing temporary rental assistance to them until they're able to stabilize themselves and obtain stable employment. If persons continue with their education, those are other aspects that we will contribute to as well. That is done over a period of time, and they are monitored until they are stable in the community.
Are there other questions? All those in favor of TP 57, Children and Family Services Support, $485,000 in 2018 and $485,000 in 2019. Standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. TP 60, Housing Assistance, $373,000 in 2018 and $373,000 in 2019. Are there any questions?
Sorry, Mr.
Member for
Chairman.
Boddentown West.
Thanks very much. Which one are we doing? TP 60?
TP 60.
Okay, I know we had a previous one where we did something similar. Is this different, or is this?
Same question I had.
It's. Yeah. Okay, thanks. Did we vote on this already?
Through you, Mr. Chair, TP 75 is
TP
TP
60.
60, sorry, is the funds that is specific for the housing repairs. The output that was covered earlier on as it related to the housing repair section covered the staffing expense that was related to this particular service.
Okay, thanks for clarifying. No, that's all right. That's what I'm making sure I wasn't going crazy. Yeah, okay. Thanks, Mr. Chairman.
All those in favor of TP 60, housing assistance, $373,000 in 2018 and $373,000 in 2019, standing part of the schedule to the bill, please say aye. Aye. And those against, no. The ayes have it. TP 75, needs assessment support, $500,000 in 2018, $500,000 in 2019. Are there any questions? Member for Newlands.
Thank you, Mr. Chairman. Just again, if the Chief Officer could get a brief explanation of what this is for.
Through you, Mr. Chair, this is the funding that would be utilized to assist persons with particular utility expenses that they might require some assistance with.
And this is outside of the normal, I think it was a vote we did earlier, assistance that's provided for like utilities and so on. I think we had a vote earlier. I think it was
Not for utilities.
not for utilities.
No, Mr.
Oh,
Chair-
okay, those were rent. Yeah,
Right.
sorry.
Mr.
Okay.
Chairman, yeah, there are a number of heads and places where money is provided for to assist people who are having challenges. So this one, it says needs assessment support. In other words, support once a needs assessment has been done. $500,000 in each year.
There are no further questions. All those in favor of TP 75, needs assessment support, $500,000 in 2018 and $500,000 in 2019. Standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. OE 78, depreciation of Ministry of Community Affairs executive assets, $27,000 in 2018, $27,000 in 2019. Are there any questions? There are no questions. All those in favor of OE 78, depreciation of Ministry of Community Affairs executive assets of $27,000 in 2018 and $27,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
Those against? No. The ayes have it. EI 54, Ministry of Community Affairs, $150,000 in 2018 and $150,000 in 2019. Are there any questions? Member for Northside.
Yeah, through you, Mr. Chairman, the breakdown of this on page 278, 378 of budget estimates has a number of significant things, but no funds. Is that because the Ministry of Sports is now removed to another ministry, and things like the East End primary playfield upgrades, Northside primary playfield upgrades, scoreboard, Red Bay primary sports facilities upgrades, Borden Town box and gym, Center for Excellence Truman Borden Complex, youth facilities, will all be transferred under the Ministry of Sports.
Mr. Chairman, I want to thank the member, the leader of the opposition, for answering his own question absolutely correctly.
Thank you. Thank you. Yeah, man.
There are no further questions. All those in favor of EI 54, Ministry of Community Affairs, $150,000 in 2018 and $150,000 in 2019, standing part of the schedule to the bill, please say aye. And those against, no. The ayes have it. We're on a roll. Members of the committee, this now concludes the appropriations to the Minister of Community Affairs.
Mr. Chairman, I wish to thank the committee and also to thank my team here, the Acting Chief Officer, Mrs. Teresa Echenike, the Chief Financial Officer, Mr. Joel Burke, and his Deputy, Melissa Worms, as well as the head of DCFS, Mrs. Felicia Robinson, and the head of the NAU, Ms. Tamara Hurlston, for their assistance to the committee. I can wish them all good night and encourage my colleagues in Finance Committee to, with me, persevere for another couple of hours so we can complete.
Okay.
Mr. Chairman, just on behalf of the opposition, I can't say anything about Shadow, but I had responsibility for following the Premier's ministry, and I just wanted to thank the Chief Officer and her team as well, and encourage her. She did it. She handled herself very well, and you know, we can only encourage them and ask them to continue the struggle, and we'll support them as much as we can.
Great. Thank you all. And we next are going to deal with the appropriations to the Premier through the Cabinet Office. But are members mindful to take a very short break? Yes, please. Let's break for 10 minutes. Okay, no more, please.